Hello and welcome to Talk Trillium, Partnering for Patients. My name is Patty Cochran, Senior Vice President, Clinical Strategy and Chief Innovation Officer at Trillium Health Partners, which includes the Credit Valley Hospital, the Mississauga Hospital, and the Queensway Health Centre. I'll be your host as we take a look at how our hospital is working to create a new kind of healthcare for a healthier community. It's my great pleasure to welcome Dr. Ian Zenlea. Ian is a pediatric endocrinologist, and Sheryl Parikh, welcome. You're a social worker, and both of you are co-leading a new program for the Youth Diabetic program. So Ian, Dr. Zenlea, can you explain what this new program is?
Yes, so thank you, Patty, for having us. We're pleased and honored to be here today. So this is actually a great new project that we have in our pediatric diabetes clinics right now at Mississauga Hospital, but we also have a clinic site at the Credit Valley Hospital. In this new project or program, we're actually routinely asking our adolescents with type 1 diabetes about their quality of life, emotional well-being, and specifically looking to see if they have depression, which we know is about 3 times more common in adolescents with type 1 diabetes compared to their peers. And if we identify depression, we're actually offering treatment in our clinic. Our nurse is working in partnership with our social worker and with a child psychiatrist to actually identify, diagnose, and then offer treatment for depression.
So why is it so important to link diabetes and depression? Like, what is the relationship between the two, and why is it important that we identify depression with children that have diabetes, type 1?
So depression, because we know it's more frequent in adolescents with type 1 diabetes, it can become really problematic for how they manage their own diabetes. So diabetes is a lifelong chronic condition, and it involves giving insulin injections, monitoring blood sugar, and when you're depressed, you just struggle to do those daily activities of general life. Depression impacts how you function in school, with your friends, how you get along with your family. Now imagine that when you're trying to manage a chronic disease like diabetes.
Now it's interesting, so before the new program started, you didn't do any screening for depression or how kids were actually managing. It was really an approach around the disease. So Sheryl, how has this changed things within the clinic? Has it changed anything at all?
It's really changed the entire culture where the staff are comfortable asking patients about how they're feeling. And it's been very well received where the patients, the teen patients really seem to appreciate being asked not just about their diabetes control, but also what's going on in their families, with their friends, how their mood has been. So we're getting a better picture of everything about our patients.
So it's becoming much more holistic in your view.
Exactly.
About both the patient and the family.
Definitely.
Yeah, that's correct, because a diabetes clinic visit can feel very medical. You come in, you review their blood sugar numbers, how much insulin they're getting, and sometimes there just hasn't been an opportunity to really go in depth and explore some of those struggles that the adolescents are having in those areas like school and family and peer relationships.
So how do you identify a child that's depressed? How does that happen?
So the main part of it is really beginning the conversation and asking them about how they're doing in various areas of their life. Depression in adolescents can look similar to how it does with adults, but it also can look a little bit different. We look for sadness, but we also look for irritability and anger. Of course, we see that in all adolescents because it's a complicated time in life. So we're looking for sustained issues, persistent issues that are interfering with their ability to live the life they want to be living. So they may be losing interest in things that they used to be interested in, or becoming less involved with extracurricular activities or friends. Mm-hmm. Ultimately, we bring all that information to our team and our physicians and our consulting psychiatrists to look for a diagnosis. Some of them will have a diagnosis of depression, and other will just have depressive symptoms, which we also want to work with so that we can prevent it from escalating into a full depression.
And I understand this is quite unique, both in Ontario, but I think internationally. Mm-hmm. You had to search for a screening tool. I think you found one in the Netherlands.
Yeah, so we're using that's very true, Patty. We're using an instrument that was developed in the Netherlands by an international group of psychologists and other researchers that's really specific for diabetes. And so the adolescents come into the clinic, they complete this questionnaire, and they also, if they score abnormally on the questionnaire for low mood, then they go on to a secondary questionnaire. And the reason why we use questionnaires is because some adolescents, to Sheryl's point, may not have felt comfortable talking about how they've been feeling. And sometimes it's just easier to check some boxes and to some questions.
Now, I know that this is a pilot program. You're starting at Mississauga Hospital site. Do you have any plans to spread?
We are looking to spread so that we can provide this service to all our patients at Trillium Health Partners, so at our Credit Valley site as well. There's also been interest from other diabetes clinics within the province to learn from our project. So we'll be sharing it with the Ontario network as well.
Well, thank you very much for sharing your new program. It really is understanding, truly about the whole patient's life and how it impacts their disease. So thank you for joining us today. Dr. Zenlea and Sheryl, you're really transforming the system. And remember, if you have any questions that you would like answered, please send us an email at talk.trillium@thp.ca.
What are the types of diabetes? Diabetes is when the body cannot make or use its insulin. The body needs insulin to use sugar as an energy source. Type 1 diabetes means the body cannot make insulin. Type 2 diabetes means the body does not make enough insulin or cannot use it well. Tools to live a healthy life with diabetes include eating healthy, being active, and taking medication or insulin as prescribed.
My name is Heather Nesbeth, and I'm a registered nurse. I work in the Diabetes Center. I'm a certified diabetes nurse educator. And I started working at what was then called the Mississauga General in 1989. So I've been here a very long time. I've been working with diabetes education since 1990. I came here in 1988, so I grew up in Jamaica. My nursing career was actually started in Jamaica. That's where I did my nursing. I think I knew I wanted to be a nurse from very young because I had an aunt who was a nurse, and she was my favorite aunt. That's where it all started. So one of the things that I teach is blood sugar monitoring. So we teach clients how to use a blood sugar monitor correctly. Right now, what we're going to do is I'm going to teach you how to test your blood on a blood sugar meter. If they do experience a low blood sugar, how to recognize the symptoms and how to treat that and what they will treat it with. This is the needle that you will use to stick yourself, and this is the lancing device. So we're going to put the needle in here. As a diabetes educator, we are, of course, counseling people about their diabetes, looking after their blood sugars, doing their blood sugars, their meals, their exercise, looking at other things that impact them as well, as like high blood pressure and cholesterol. We do counsel on those things as well. And we're going to touch it right there and hold it till you hear that beep. So if we look in the meter now, we can see that your blood sugar result has actually come up. We also have a foot clinic here. It's only for our clients. It's a preventive program because what we're doing is looking at cutting our clients' toenails for people who can't for various reasons, or because they have neuropathy, and neuropathy is one of the complications of diabetes where you lose sensation or feeling in your feet, or you have very little feeling in your feet. So something as simple as cutting their nails when they have neuropathy can be very catastrophic and limb-threatening. I'm going to use this little bit of plastic. It's not painful. I want you to close your eyes. We have this 60-second monofilament testing, which will show whether the clients have lost feeling in their feet or are losing feeling in their feet. And the reason why this is important is because if they have no feeling or very little feeling, they can damage their feet and not know it. You can open your eyes. So I touched you at about 10 places. My passion is feet. So a day when I can get to do mostly feet, I'm really happy because I always say that that's my downtime. We'll just take the top of it off. That is a time when clients really talk to you. and you know, they tell you about their life in general, and they show you their grandkids' pictures and their kids' pictures and tell you all the good things that's happening in their life. And they kind of get a little rest from, you know, what the blood sugars are and, you know, you need to do this and that. That is one of the services we offer that we're very, very proud of, because I don't think many or any other diabetes center across the province actually offers that service in-house. I would also recommend that what inspires me is people. I love people, I like to help people, and I want to think at the end of the day that I did make a difference in somebody's life. And that is what inspires me, coming to work and knowing that I am making a difference.
Eating enough vegetables can be a challenge for many of us, even though we know that eating vegetables is very healthy. They provide us with a lot of fiber that can help to manage our blood sugars, and fiber also helps to make us feel full, that aids with portion management. And vegetables provide us with a lot of vitamins, minerals, and antioxidants that can help promote heart health and may reduce the risk of certain cancers. When we're thinking about how much vegetables to eat each day, what we're really wanting to do is to aim to eat a colorful rainbow and aim for at least a half a plate of vegetables, or in other words, try to incorporate 2 large handfuls of vegetables with most of your meals. Today we'd like to show you a few different ways, a few different strategies to help boost your vegetable intake. So first off, we've got a variety of fresh cut raw vegetables. And this is a great opportunity to involve some other family members that can get in there and help with rinsing the vegetables, maybe chopping them, and also putting them into storage containers. Some families like to put them in one large storage container to keep on hand in the fridge, while others prefer to create these quick and grab and go single serve packages. Here we've paired our veggies with 2 healthy dips. The first one is a Greek yogurt based ranch dip that provides a little bit more protein and is lower in fat than your traditional ranch dips, and also a store-bought hummus. Now, certain times of the year you may be craving warmer sort of comfort meals, and that's where roasted vegetables may be more appealing. We've selected some seasonal vegetables, washed them, diced them, and then roasted them in the oven for about 15 to 20 minutes at 375 degrees Fahrenheit. I'm a big proponent of cooking once and enjoying twice. So again, we wanted to leave you with a couple sort of tips to create another meal from your leftover vegetables. First off, we've diced up some of the leftover roasted vegetables into bite-sized pieces, layered them on a bed of cooked quinoa, and we've topped it with a little bit of goat cheese and some walnuts for a little extra healthy fat and protein, and then drizzled on some balsamic vinaigrette. Lastly, another great way to boost your vegetable intake would be to create a large pot of vegetable soup or stew. Here we've used a low sodium broth, or you could use water, and dice up any leftover vegetables that you have in the fridge, or even throw in some frozen vegetables. And there you have it. So hopefully we've given you a few suggestions and tips to boost your overall vegetable intake as well as your overall health. For more information or for resources, please visit dietitians.ca.
We are very lucky to have 2 diabetes educators from our Diabetes Management Center here to educate us about type 2 diabetes. I'd like to welcome Pam Osborne, registered dietitian and certified diabetes educator, clinical team leader, and Nermin Ibrahim, registered nurse and certified diabetes educator. Welcome to Talk Trillium.
Thank you.
Nermin, can you tell me, what is type 2 diabetes?
Type 2 diabetes is a condition in where the sugar or glucose is higher than normal in the blood. An easier way to explain diabetes is that when we eat food that have carbohydrates like rice, pasta, potatoes, fruits, once we eat them, they get broken down and turned into sugar. Once the sugar hits our blood, it sends a message to an organ called the pancreas. What our pancreas will do, it's going to produce a hormone called insulin. An easy way to think about it, think of insulin as a key. So it's going to go to our blood, pick up a piece of sugar, then it's going to go to our cell, unlock the cell door, and get all the sugars inside the cell for energy. When people have type 2 diabetes, their pancreas is not producing enough insulin. So they don't have enough keys, so the sugar will tend to sit back in the blood instead of in the cell for energy. An easy way to diagnose diabetes is by seeing the family doctor and getting blood work done to help with the diagnosis.
Great. And who's at risk for developing type 2 diabetes?
There are several risk factors for people to develop type 2 diabetes. One of them is a strong family history of diabetes, having had gestational diabetes or having had a large baby, being from a specific ethnic group like Asians, South Asians, Hispanic, Aboriginal, Middle Eastern, also being over the age of 40, as well as having prediabetes will put people at a high risk of having diabetes.
Pam, can you tell me, can type 2 diabetes be prevented?
Yeah, that's the good news, Patty. Type 2 diabetes can be prevented or delayed. And if you're already living with type 2 diabetes, you can also certainly live a healthy life. And that's the message we really want people to have at the Diabetes Center.
So how do I prevent diabetes?
Well, there are a number of things that you can do. And the first would be healthy eating. So learning what you can around healthy eating, taking advantage of good websites. I could recommend Eat Right Ontario, Dietitians of Canada, or the Canadian Diabetes Association as places to start. It's important to be physically active. So current recommendations for type 2 diabetes are 150 minutes a week of physical activity. So that sounds like a lot, but you can chunk it down into smaller pieces. It is important to start slow and build up according to your fitness level and check with your doctor first. The other thing that's important is weight management. So if you're somebody who does have weight to lose, it's important to know that even a modest amount of weight loss, maybe 5% of your body weight, will actually usually show improvements in blood pressure, blood sugar, and cholesterol.
So if I understand it right, eat properly and follow some food guidelines, exercise, and watch your weight.
Correct. Those are good places to start.
Wonderful. And you know, in a previous show we just aired, we talked about keeping your minds healthy as we age, and physical exercise and diet were also part of that. So it sounds to me like if you do those things, you can keep your mind healthy as well as try and prevent diabetes.
Yeah, that's the goal.
So if my doctor were to tell me that I'm pre-diabetic or that I have type 2 diabetes, what's the first thing I should do?
Well, slightly different for pre-diabetes versus type 2 diabetes, but pre-diabetes is, as Nermin mentioned, a risk factor for developing type 2 diabetes. And certainly a lot of the information that I just mentioned around eating, physical activity, and weight management will help turn the clock backwards. But if you have been diagnosed with either pre-diabetes or type 2 diabetes, I would say number one, working with your doctor is critical, and asking for a referral to a diabetes education program. And there are actually 5 programs in the Mississauga-Halton region that exist to support people with pre-diabetes and diabetes.
Wonderful. Thank you very much.
Okay.
So Nermin, tell me, if I'm a parent and I have type 2 diabetes, what does that mean for my child? Will they necessarily get diabetes too? Is there a link between genetics?
Unfortunately, yes. Diabetes, there's a genetic component to it. If the child inherit the gene that will tend to say or will tend to cause their pancreas to produce less insulin, then they are at a higher risk of developing type 2 diabetes. But like Pam have said, it can be prevented, it can be delayed. Another reason what people could do is that, or could develop type 2 diabetes, is that something called insulin resistant. So when the body have a lot of insulin on board, but the person is not keeping active, they carry a lot of weight around their abdomen area, then the body cannot use that insulin properly. So the only way to prevent diabetes is by keeping active and leading a healthy lifestyle.
Is it ever possible to be diagnosed with type 2 diabetes, lose a lot of weight, become active, watch your weight better, and then not have a need to take any medication for type 2 diabetes? Can you reverse it?
So type 2 diabetes is not reversible, but the good news, it is manageable. What we tend to tell clients is, yes, we've seen people go on medication, work their hardest, eat healthy, start exercising, and all of a sudden the weight will go down. Then their need of medication will also go down. And we've seen people stop their medication by keeping active and losing weight. Would it be fully reversed? No, but it can be managed.
Thank you for joining us today, Pam and Nermin, and teaching us more about type 2 diabetes. And remember, if you have any questions that you would like answered, please send us an email at talk.trillium@thp.ca.
So people with type 1 diabetes do not make any insulin, and most of them need insulin right from the time that they are diagnosed. People with type 2 diabetes usually have a combination of insulin resistance, where their body does not use the insulin that is being made, and insulin deficiency, where over time their pancreas does not make enough insulin. These people can be controlled with diet, exercise, various medications, and some of them will end up needing insulin after a period of time. If you have type 2 diabetes, you can start with medications, and some of these people will need insulin eventually, but they're still considered to have type 2 diabetes. There are many complications of diabetes, and the medications that we use help to prevent people from developing complications related to diabetes, such as problems with their eyes, problems with their feet, problems with their kidneys. And we know that diabetes can increase someone's risk of developing heart disease and stroke. So the medications that we use help to control these various aspects to reduce someone's risk of developing problems. The main way to prevent complications related to diabetes is by keeping your blood sugars under good control, and to do other healthy things, such as not smoking, eating a healthy diet, and exercising regularly. Not necessarily. We know that women that have diabetes in pregnancy, which is called gestational diabetes, they have a higher risk of developing diabetes later on in life. But there are many things that can be done to reduce this risk, such as healthy eating and regular exercise. So one of the complications of diabetes can be problems with the feet. So what we encourage patients to do is to look at their feet, to look for any cuts, scratches, anything that looks out of the ordinary, and also to pay attention to how their nails are cut. The Diabetes Management Center at Trillium Health Partners is dedicated to help people better manage their diabetes. We have a multidisciplinary team which consists of nurses, dietitians, social workers, exercise specialists, and endocrinologists, and our goal is to help people better manage their diabetes and to educate them as to what they can do to keep their sugars under good control.
Thank you for watching Talk Trillium, and see you next time.